I'm Jeanette Schmidt, the nurse educator at Parkside OB-GYN. In this video, let's explore some common pregnancy symptoms, starting with the first trimester. These are common symptoms you may experience through week 13. First, I want to address the emotions that tend to dominate the first trimester of pregnancy. Whatever emotions you encounter during this time, they are completely valid, and you should just let yourself feel them so that you can move through them. Yeah, many women do feel absolute glee when they find out they are pregnant. But some women may feel scared or anxious, confused, or even absolute dread. And these emotions can come on regardless of whether this was a planned pregnancy or a big surprise. These initial feelings aren't an indication of how you will be as a mother to your baby. You're simply being human. Allow yourself to be human. Nausea is an incredibly common symptom in pregnancy. Sometimes it's accompanied by vomiting, and some women just struggle with just the nausea, which may lead to food aversions. So, nausea and vomiting isn't necessarily a reason for concern unless it becomes so severe that you become dehydrated or malnourished. So, why does it happen? Well, the term morning sickness isn't really an accurate term because it can definitely affect women at all times of the day. So, this phenomenon is believed to be caused by increases in certain hormones during early pregnancy. And there tends to also be slower gastric emptying, which is when your stomach empties during pregnancy, and that can lead to nausea, vomiting, or constipation. Some ways to cope with nausea and vomiting include eating smaller meals, eating bland foods, avoiding greasy or fatty foods, and just being sure to stay well hydrated. If you have signs of becoming dehydrated, you should definitely notify a provider to be seen. You may need fluids. Signs of dehydration could include a fast heart rate even when resting, feeling dizzy or faint, unable to keep liquids down, or producing little to no urine that's dark in color. Another common symptom is fatigue and exhaustion. This can hit you before you even know you're pregnant. It can be pretty intense. It's like you're just unmotivated, and even simple tasks just wear you out. And the naps are fantastic, but you're afraid others are just going to think you're lazy. Sometimes this makes it hard to distinguish if you're just exhausted or if you're suffering from depression. And the good news is the fatigue usually eases as you enter the second trimester after week 14. So, why does it happen? First, cut yourself a little slack. Your body has taken two individual tiny little cells and has done some really extensive work building a human from scratch. And by week 13, baby's heart, neural tube, and skeleton have all formed and will continue to grow and develop throughout the pregnancy. So, though you can't see all of that hard work, it's quite the demand on your body. One of the best things to cope with the fatigue and exhaustion of pregnancy is to rest. Take the naps when you can and enjoy them as much as possible. If you have other children at home, this can be a lot more challenging. Ask your partner or other family members for help and take it easy when possible. You should start feeling a little more energy within a few weeks. Another common symptom in the first trimester of pregnancy is breast tenderness, much like what women experience at the start of their menstrual period. This breast tenderness tends to occur as a result of hormonal changes in your body related to pregnancy. One suggestion to cope with that tenderness is to wear a good supportive bra that does not have wires. A snug sports bra will provide good support during this first trimester. Mild uterine cramping and even light spotting can be very common in the very early weeks of pregnancy. So why does this happen? Well, it can be related to the implantation, which is when the fertilized egg attaches to the lining of the uterus. This is usually around 10 to 14 days after conception and can also be around the time that you would be expecting your period. Ways to cope with this. Well, you should not take ibuprofen or other NSAIDs when you're pregnant. If you are worried about the spotting, you can wear a pad or a panty liner. And honestly, just rest as needed. This will dissipate as you move through your first trimester. Mild headaches can also be a common symptom early in pregnancy. So why does this happen? Again, you have hormones surging through your body, and already your blood volume is increasing, meaning you have more blood flowing through your body. Also, cutting back on caffeine can cause withdrawal headaches. So try to taper your caffeine slowly. To cope with these headaches, one thing you can do is kind of rest your eyes in a dark room and maybe press a cold compress on your head for a short period of time. This may provide some relief. Also, again, tapering your caffeine levels slowly over a period of days versus quitting cold turkey may help. If your headache persists or it's affecting your day to day quality of life, reach out to a provider for other potential remedies. Early in pregnancy, you may be noticing soreness in your lower back and maybe even sharp pains in your hips and pelvis. These symptoms are tied to round ligament pain. So, the round ligaments in your pelvis are already trying to prepare for birth. They're stretching and adjusting, sometimes even this early in pregnancy. I very strongly recommend a belly band, even early in pregnancy. It's a game changer postpartum as well. But early in pregnancy, if you have a stretchy, elastic, wide belly band that has Velcro and you place it low upon the hips, it can provide support like a snug hug and it can kind of help ease that ache a little bit. And there you have it, the most common symptoms early in the first trimester of pregnancy. Thank you so much for taking the time to learn more about this. Please remember that this information is intended for patients of Parkside OB-GYN and is very generalized. Always follow the directions and advice of your healthcare providers regarding your specific symptoms and needs.